Okay, well, hopefully everybody's in the room now. I'm going to get started. Good morning. My name is Lisa Saksida, and I am a professor at Western in the Department of Physiology and Pharmacology. I'm also a Tier 1 Canada Research Chair in Translational Cognitive Neuroscience. And before we actually get started, I'd like to invite you to just take a couple of moments to reflect on the history of the Indigenous peoples on this land. I'm located in London, Ontario, and I acknowledge that Western University is located on the traditional territories of the Anishinaabeg, the Haudenosaunee, the Lenape-Pewuk, and the Chongongton nations on lands connected with the London Township and Sombra Treaties of 1796 and the Dish with One Spoon Covenant Wampum. It's important to add that this land continues to be the home to diverse Indigenous peoples who we recognize as contemporary stewards of the land and vital contributors to our society. So thanks to everyone for joining us here today. This is one of those rare opportunities that we have in research where we're meeting with people from all sorts of backgrounds. So we've got researchers here, government officials, business leaders, Alzheimer Society board members and volunteers, care partners, clinicians, and individuals living with dementia joining us for today's event. It's really quite an incredible opportunity to connect. So if you have questions or comments about any of the information that we provide today, please just put them in the Q&A box that you should see at the bottom of your screen. And we'll have time to answer those questions at the end of the presentation. To just give you a little bit of additional context, I'm speaking today in my position as co-scientific director for Western University's BrainsCAN initiative. Our other co-scientific director, Ravi Menon, is also here in the Zoom room. BrainsCAN is a neuroscience research initiative at Western aiming to transform the way that brain diseases and disorders are understood, diagnosed, and treated. Since 2016, we have brought together researchers from all across Western and institutions around the world to accelerate discoveries in brain research. With our work, we now know more about the complexities of the human mind, about things like how the brain allows us to perceive the world, to form memories, and to communicate our thoughts, and also more about what can go wrong when these processes are disrupted. Our work is supported by a federally funded research grant from the Canada First Research Excellence Fund through the Government of Canada. And the funding that has been provided to BrainsCAN through that mechanism is the largest in the university's history. We're thrilled to have that investment from the Government of Canada, and our research will help the 1 in 3 Canadians who are affected by a brain disorder, brain disease, or injury. While our work is mainly research focused, one of our additional aims is to connect with community-based organizations working directly with those with neurodegenerative conditions. We strongly believe that impact doesn't only take place in the lab, but also in the community. And so this is how we became involved with the Alzheimer Society Impact Survey that we'll be discussing today. So during today's presentation, we're going to be hearing from Cathy Barrick, who is CEO of the Alzheimer Society of Ontario, from Ryan Salewski, who's an associate director for BrainsCAN, from Carol Walters, who is CEO of the Alzheimer Society Southwest Partners, and from Deb Weber, a care partner and Alzheimer Society Southwest Partner board member. We'll also be hearing shortly from London North Centre MP Peter Fragiskatos, who has been a champion of our work for many years. But just before we get to Peter, I'd like to acknowledge some of the other attendees that will be here today. So joining us today, we'll also have Ariel Kayabaga, MP for London West, Lindsay Matheson, MP for London Fanshawe, Terence Kernahan, MPP for London North Centre, and Teresa Armstrong, MPP for London Fanshawe. And we are absolutely delighted to have so much support here today for this initiative. I'd also just like to take a second to thank 2 of our BrainsCAN staff members who have been absolutely essential to all of this. Maggie McClellan, who conceived of this project and who has expertly guided it through all of its stages, and Ryan Salewski, who I've mentioned already, who you'll be hearing from in a second, who applied his considerable expertise to designing the survey and crunching and interpreting the data that have come out of it. And then again, thanks to all of you for joining us during Alzheimer's Awareness Month. I'm now going to pass the mic over to our Member of Parliament for London North Centre, Peter Fragiskatos.
Well, good morning, everybody. Thank you very much, Professor Saksida, for your work, first of all, that of your colleagues as well, certainly, and for the invitation this morning. What an opportunity to see people that truly care about research, but research that extends beyond. This is a partnership that we see between BrainsCAN and what began, as I understand it, with the Alzheimer Society of Southwest Partners, and now has reached beyond to Alzheimer societies throughout the province. It speaks to a number of things. It speaks to the fact that there is, within communities across Ontario, not to mention across the country, a deep desire for enhanced understanding of Alzheimer's and its victims and those who continue to live with it every day and their families. The opportunity to bring together researchers and those organizations who act as advocates in the first instance, but go beyond and help individuals on a daily basis and their families as well, as I say, is a wonderful thing. For me, as someone who has represented the community now for 6+ years, this investment that the federal government made, going back now to the fall of 2016, is really not just important. It was something that was advocated for a long time, and it's produced tremendous results, not just in terms of Alzheimer's research, but certainly strokes, autism. There's many other examples, as we know. But here we're talking about Alzheimer's. We're talking about an organization that wanted to better serve its clients and worked with BrainsCAN to make that happen through the client survey that's been developed. The results of which I'm interested to hear this morning, as we all are. But I think it speaks to the fact that you can have researchers who are absolutely devoted to the academic side, as they must be, but take it one step further, as Western researchers so often do, to reach out to the community and build bridges, so to speak, so that we can have better outcomes for everyday people. Because in the end, that's what health research is ultimately all about. It's not just about producing findings for the sake of it. It's about making sure that people have an enhanced quality of life. So to all of those involved in the BrainsCAN initiative, to all of those involved locally here with the Alzheimer Society Southwest Partners, but throughout the province, thank you very much for your work. Thank you for showing that partnership is possible. Thank you for your ongoing dedication. And most of all, thank you for thinking about and caring about people living with Alzheimer's and their families. It's partnerships like this that make their lives better. So really appreciate it. And once again, thank you for including me here today.
Thank you so much, Peter. Those were lovely words, and I really appreciate, as I said before, your support now and over the years. Next, we're going to turn to Cathy Barrick, who is CEO of the Alzheimer Society of Ontario.
Good morning, everyone, and thank you, Lisa, for the introduction. The Alzheimer Society is grateful for the amazing partnership with Western's BrainsCAN to study the impact of Alzheimer Society program and services on care partners and those living with dementia in Ontario, and the hopeful positive follow-on effect on the Ontario healthcare system. The Alzheimer Society is a federation of 27 local community support providers across Ontario. We supported over 100,000 clients last year, including both care partners and people living with dementia. We provide education, counseling, and support within our communities to healthcare providers, those living with dementia, care partners, and the general public. We know that dementia is quickly becoming a defining societal challenge for all of us. With numbers of those diagnosed with dementia projected to double in the next 20 years, we are painfully aware of the strain this puts on families, communities, and the healthcare system. Throughout the COVID-19 pandemic, it is hard to separate the impact of dementia on healthcare and vice versa, the impact of healthcare on dementia. Dementia is hallway medicine. Dementia is long-term care. They are inextricably bound, and both have contributed to the COVID healthcare crisis, and have people living with dementia and their care partners have been seriously impacted by the pandemic restrictions and COVID outbreaks. These issues make the partnership between BrainsCAN and the Alzheimer Society that much more impactful. With insights from this study, the Alzheimer Society is better able to measure the impact our programs have on those we serve and the way we can contribute to keeping people living with dementia at home longer and supporting those who care for them. This information then translates into recommendations for funders to alleviate the strain that dementia creates at both personal and system-wide levels. I'd like to share with you some key elements of the study that are particularly relevant to the Alzheimer Society. All Alzheimer Societies in Ontario participated in the study, with 1,912 care partners and 272 people living with dementia having completed the survey. Care partners were mostly women, while respondents who have a diagnosis of dementia were gender balanced. Those living with dementia skewed older than care partners. The respondent group had representation of LGBTQ2S+ at 5.7%, Indigenous peoples at 1.7%, visible minorities at 6.1%, and people with disabilities at 21.7%. When respondents were asked how long they have been engaged with the Alzheimer Society, 38.1% indicated their involvement was for less than 1 year. This group of new clients indicates the continuing growing need for Alzheimer Society programs to serve new clients across the province. When examining the level of care required, care partners noted their respective person living with dementia required additional support, where 50.9% need a lot of support and 42.6% needed some support. These are only a few of the findings that will help the Alzheimer Society improve the quality of life and care of Ontarians living with dementia and their care partners wherever they live. In addition, data demonstrating impact is crucial in advocating with funders to provide adequate and timely support for a community-centric system of care. Currently, the government is being asked to invest $586 million in the community support sector. This modest investment, as evidenced by the partnership between BrainsCAN and the Alzheimer Society, could not only improve the lives of those living with dementia and their care partners, but it also has the potential to alleviate the crisis currently existing in healthcare today. I'd like now to turn things over to Dr. Ryan Salewski, who is the Associate Director at BrainsCAN. He will help illuminate the significance of the data. Ryan, over to you.
Well, thank you so much, Cathy. I'm just going to share my screen here quickly. Okay. Hi everyone. I'm Ryan Salewski. Thank you for giving me the opportunity to speak here today. My involvement with this project has been an aspect of my job that I've found extremely fulfilling. As someone who spent a significant part of my career in lab-based neuroscience, you could sometimes feel that you're disconnected from the community that you're striving to then help. Through engaging with the Alzheimer Society, I have been able to get a small glimpse into some of the struggles of people living with dementia and their care partners. Also, the vital role the workers and volunteers at the Alzheimer Society play in their lives. Also, I learned that the real unsung heroes are often the care partners. And sorry if I'm going to spoil the end of my presentation here, are truly propping up a pillar within the healthcare system. My role in this project was translating the attitudes and experience of care partners and persons living with dementia in Ontario into quantifiable metrics. Essentially, we wanted to take anecdotal evidence of people's experience with the Alzheimer Society and try to quantify it in a way that allowed us to make more generalizations. It is important to remember as we go into more detail here that we're examining the opinions and the perceived benefits of a population of people that access the Alzheimer Society. This isn't to diminish the results, just to make sure that we're interpreting them in the correct context. So to achieve this goal, we developed and ran the first Ontario-wide client satisfaction survey. The real challenge was collecting as much information as possible without it being overly burdensome. This was further compounded by the fact that we felt it was very important that people living with dementia were also given the opportunity to complete the survey and have their voices heard. The survey used was a product of several years of piloting in southwestern Ontario with comments from the societies involved, as well as with input from people with lived experience. There were administrators at each site to help with the distribution and general assistance. We had online versions, paper versions, as well as an option to complete it over the phone. Plus everything was offered in both English and French. As you can see here, we were fairly ambitious. We looked at a lot of areas where the Alzheimer Society provides impact, then took those results and further analyzed them based on other factors. For example, we looked at how the need for support changed during COVID-19. Overall, there was an increase, but when we further examined looking at age, we saw that the younger care partners noted a greater increase in their needs for support during this time. When we looked at a respondent's ability to make meaningful connections with people in similar situations, we noted a gender gap, with men struggling to form these types of relationships. For the rest of my presentation, I'm going to concentrate on these two areas, capacity for care and distress intervention, with a specific focus on crisis avoidance as well as extended time at home, since these intersect more directly with the healthcare system. But if you're interested in the full data, I would urge you to go to this website here, and you'll be able to see the full information. As I mentioned earlier, the starting point for many of these metrics are personal experience. With regards to crisis avoidance, a care partner said, "I was able to cope much better. I have literally dropped my husband off at the ER before as I was at the end of my rope. Now I have the skills to communicate with him better and avoid arguments." Our survey tool allows us to quantify these types of statements, and now we are able to say 33.6% of care partners indicated in the past year Alzheimer Society support helped them avoid crises, which that would likely have required immediate intervention, such as an ER visit. On average, these care partners estimated 2.1 fewer of these crises last year. With regards to delaying entry into long-term care, a care partner said, "My mom was diagnosed 7 to 8 years ago. With Alzheimer Society support, we were able to have her stay at home until 2 years ago." We can now extend this and say 39.8% of care partners supporting someone in assisted living or in long-term care noted that Alzheimer Society support delayed their decision to access this resource. On average, these respondents stated that Alzheimer Society support delayed this decision by an estimated 1.4 years. I do want to have a quick aside here and just mention that even though we can see a benefit in the additional time within the home, that's not the Alzheimer Society's primary focus. They strive to get people into their best possible situation. So I do want to mention that in addition to the comments like the one above, I read so many statements thanking the Alzheimer's Society for helping their family navigate the often difficult process of getting their loved one into the right long-term care. So just showing another way that the Alzheimer's Society does serve its client base. But anyways, back to the presentation. With regards to continued care at home, a care partner said, "She's at a stage now where I don't think she'd be at home. We wouldn't be living together still if it hadn't been for our experience with the Alzheimer's Society. It has given us a little more time together." This leads to our statement that 28.4% of care partners supporting someone within the home noted that they would have likely accessed assisted living or long-term care by now, if not for the Alzheimer's Society support. That is over 1 in 4 care partners that feel they are currently able to provide care in the home directly as a result of the support that they receive from their local Alzheimer's Society, which is truly incredible. So now I'm going to dive into the math a little bit, but I will try to keep it quick. For these metrics, we can extrapolate to an estimated cost impact per care partner. In brief, we can spread out that cost impact from a subset to the full group to get a value as a function per care partner. If we continue to focus on the last example of continued care at home, when distributing cost savings, we need to consider a few factors. 79% of care partners are providing care in the home, and 28% of those people indicated that they felt without the Alzheimer Society, they would have already accessed assisted living or long-term care. Then using a recent Ontario budget figure that noted the cost of a long-term bed at about $55,000 per year, we can calculate what the overall impact is. Briefly, we can multiply 55,000 by 69% and then 28% to get the savings due to continued care at home per care partner, which works out to be about 10,000. We can do a similar calculation for crisis avoidance, as well as delayed entry into long-term care. This leads to a value of over $16,000 per care partner, regardless of situational variance. Simply, this is the perceived cost benefit of these three impact areas for every care partner engaging with the Alzheimer Society. What happens when we extend these findings out to all of the care partners? It's truly remarkable. By multiplying the total number of care partners served by the Alzheimer Society by the cost impact per care partner, we get $1.3 billion in estimated savings. I know this number seems huge, so I want to talk about what this means in reality. Across all of the care partners, we can estimate that there were over 50,000 fewer hospital visits due to the Alzheimer Society support. With the Canadian Institute of Health Information stating an average hospital visit costs over $6,000, this translates into $370 million in savings. An additional $75 million as a result of the delayed access by those entering long-term care. And lastly, the majority of this figure, over $890 million, comes from the more than 16,000 care partners that said they were only able to provide care at home because of the support that they received from the Alzheimer Society. It really comes down to the fact that these care partners are providing a tremendous service that, when extrapolated out to the over 80,000 care partners served, really show their impact on the Ontario healthcare system, and reiterate in turn, shows the vital importance of the Alzheimer Societies that support them. I would like to end by saying that this report and these metrics really don't tell the entire story. I had the privilege of reading thousands of comments during the analysis, and it was an emotional experience. A common sentiment that really came across all of the demographics was true gratitude and a growth in their journey with the Alzheimer's Society. So in a time where we're celebrating the numbers, I wanted to leave you with a few quotes that show the intangibles that are at the heart of this amazing organization. Thank you. So now I will be turning it over to Carol Walters, CEO of the Alzheimer Society Southwest Partners, who has been a driving force behind this survey from the very beginning. All right, Carol.
Great, thank you, Ryan. I'm just going to share my screen. All right, well, welcome everyone, and thank you for joining us today. I'm here today representing the Alzheimer Society Southwest Partners, which is a newly formed organization as of July 1st, 2021, established through the unification of the Alzheimer Society, Elgin St. Thomas, London Middlesex, and Oxford County. Our call to action is that no one living with dementia goes unsupported. We currently serve over 5,100 care partners and people living with dementia, with services ranging from one-on-one counseling, education, social recreation, and friendly calling. We provide these services with a workforce of over 300, made up of 60 paid staff members and over 250 active volunteers. In 2018, the Alzheimer Society of London and Middlesex and BrainsCAN first developed a pilot project to analyze the Society's existing client survey. Our challenge at the time was that our client survey provided us with a lot of valuable qualitative information used to evolve our programs and services, but we lacked the quantitative data to help us analyze the impact our services were having on the overall health system. BrainsCAN used its expertise in research reporting to review our previously conducted client survey, provided an analysis, and made recommendations for future survey practices that could qualitatively support the Society's mission. Final results revealed that the Alzheimer Society services were a lifeline to its clients, but more could be done to support our community in specific areas highlighted through the BrainsCAN analysis. Findings from the report led to a formal partnership in 2019 with BrainsCAN, the Alzheimer Society London and Middlesex, and the Alzheimer Society of Ontario, to bring BrainsCAN's analytical survey method to 6 Alzheimer societies in the Community Support Services Southwest region. A BrainsCAN report for the 6 Alzheimer Society was completed in December 2019. With this new understanding of the impact of their work, the survey was extended to Ontario-wide to 29 Alzheimer societies in 2021. From a local Alzheimer Society perspective, the results of the 2021 province-wide client survey identified 3 specific areas that the Alzheimer Society Southwest Partners will focus on in the coming year. During the pandemic, programs and services offered by the Alzheimer Societies across the province were shifted to online and telephone calls. This included counseling as well as social recreation, education, care partner respite, and others. Of the Alzheimer Society clients who responded to the survey, 65.4% of the persons living with dementia and 68.4% of care partners accessed online and virtual resources during the pandemic. For those who were able to access online and virtual programs, the vast majority of these respondents indicated that they would continue with virtual care, signaling that this type of content was beneficial. For this reason, as the pandemic restrictions lift, we will confidently move forward with a hybrid approach to supports, which will help to increase the accessibility of service delivery. From a diversity perspective, we learned that there is more that we can do. We have added to our quality improvement plan an initiative to evaluate all aspects of our organization from a diversity, equity, and inclusion lens, ranging from our hiring practices to program and service delivery. We will also be expanding a pilot program we initiated over the last year called the Volunteer Collective. This program will look at engaging with organizations servicing the LGBTQ+ community, faith-based organizations, different cultural communities, and specialized organizations such as those providing services to the hearing and sight impaired community members. This type of engagement will help to expand the diversity of our workforce through providing dementia-trained volunteer opportunities at these organizations, thus opening more diverse support for people living with dementia and their care partners. Finally, we heard that the greatest sacrifice care partners make is time for self-care, activities, and relaxation. And this impact increases as the condition progresses. We also know that social isolation contributes to increased cognitive decline for many. This information supports further investment in vital programs in our social recreation service area. Expansion of social recreation programs, such as the social and in-home recreation therapy throughout our region, will provide increased meaningful engagement for people living with dementia and vital respite time for care partners. These are just a few examples of how our provincial client survey can be used to inform frontline work. As a local Alzheimer Society leader, information like this is critical to not only targeting service delivery changes to better align with our clients' changing needs, but also supporting our advocacy as a community support service organization within a vast healthcare system. I'm now going to pass over the stage to Deb Weber. Deb is a care partner to her husband, Bruce, and they became clients of the Alzheimer Society London and Middlesex in 2012 when Bruce was first diagnosed. Deb and Bruce are not only active clients of the Society, but have also been involved as the honoree family for our annual Walk for Alzheimer's, raising close to $40,000 through their walk participation over the years. Deb has served on our board of directors for the past 3 years, bringing vital client and care partner perspectives to our governance work. And Deb is also a strong advocate for dementia-friendly communities, and a member on the provincial Finding Your Way advisory group. Deb will now share with us information about her experience with the Alzheimer Society. Over to you, Deb.
Good morning, everyone, and thank you, Carol, for the very thoughtful introduction. It is my good fortune to be associated with the Alzheimer Society and the services that they have provided for Bruce and I. It will be 10 years on February 8th that our lives changed forever with one word: Alzheimer's. The previous summer, we celebrated our 40th anniversary and our 65th birthdays. Bruce had been my best friend since I was 6 years old, actually. I retired from teaching that summer, as well as my gut instinct told me that my best friend and life partner was not well. A series of medical appointments based on observations of friends and family followed, and that indeed, Bruce did have memory problems. A CT scan revealed no other evidence of brain trauma or strokes. Probably it was dementia, said our family doctor. And then we lived in limbo and hopeful denial for 8 months, awaiting that fateful neurology appointment. With that one word, Alzheimer's, our lives changed forever. We felt sentenced to a new and frightening reality. Bruce had his driver's license revoked that very day. He felt that he had lost his freedom. It was a huge blow to him, and also to me, as now I was literally and figuratively in the driver's seat. We were advised very early in our journey to get our affairs in order. We were 61. Thankfully, our family doctor also prescribed one more thing: call the Alzheimer Society. That stands out to me to this day to one of his greatest pieces of advice. I did make that call early in the game. A sweet little book by Charlie Mackesy called The Boy, the Mole, the Fox, and the Horse has a wonderful quote. It says, "What is the bravest thing you've ever said?" "Help," said the horse. The day I made that first call for help changed the course of our lives and provided safe and caring refuge in the years ahead. We were not alone. We were terrified. We had no knowledge of where we were heading. No matter how others tried to calm us, nothing would calm the fear of our future. Then came the incredible staff at the Alzheimer Society London and Middlesex. Bruce and I became actively involved there. We took the education series that armed us with the knowledge and the skills to navigate our daily life, as well as navigate the system supports. We had a social work who literally kept me from falling into the pit of my own mental health issues. The offerings of recreation programs, coupled with physical exercise and stimulation, provided hours of time for Bruce and respite time for me. We found our bearings there and friendships with others who knew and understood our fears and our feelings. In retrospect, I can say undoubtedly the greatest gift for us from the Alzheimer Society was our volunteer companion. We affectionately refer to him as our Wednesday gift. This incredible gentleman came to visit Bruce every Wednesday. This allowed me several hours to schedule appointments or social engagements, knowing that Bruce was in the best of hands. They walked and enjoyed nature. The two of them became best buddies. Greg knew that Bruce was his best when he was out communing with nature, and they enjoyed many long walks in the ravine. By this point in his disease, Bruce could not be left on his own. He had lost the ability to speak. He needed assistance with all the skills of daily living. He was beginning to wander. Our own outings, even to pick up a few groceries, became a very difficult situation. Therefore, our volunteer companion was a very important member of our ever-increasing care plan. Although we eventually received hours of in-home personal support through the then Lynn, time with our volunteer buddy was different. It was not clinical, it was social in the same way that Bruce needed to retain his dignity. Our Wednesday gift allowed Bruce and I to enjoy many more years in our home. I know in my heart, if he had not been here, that Bruce would have been in long-term care sooner than he was. Having our volunteer companion allowed us to stay for at least 2 more years in our home. We had declined a placement twice. When it became evident that Bruce's behaviors and physical needs warranted more help than I could possibly give, Bruce was admitted on September 4th, 2019 to a long-term care home. I have to say, without a doubt, that was the hardest day of my life. Our volunteer was one of Bruce's first visitors there, and he has remained forever a lifetime friend. There is no doubt that he helped preserve our somewhat normal life at home. To this day, I thank the Alzheimer Society for this gift of time with my guy in our home because we had our Wednesday gift. Thank you.
Thank you so much, Deb, for that. Sorry, I'm a little affected by your story. I think we can all relate. We all know someone who has dementia. This has touched, I think, every single one of us, and your story was incredibly powerful. And hearing about some of the support from the Alzheimer Society is really, really helpful, actually, in hearing about your experience. And I'm just thinking, we have a very close family friend right now whose husband has just been diagnosed with early dementia, and she is in exactly the situation that you're talking about, where she thinks she has to deal with this all on her own. She's reluctant to bring in medical care because it feels too medical at this point. And so I can't wait to send her the recording of your presentation, because I think it'll be incredibly helpful for her, and will encourage her to reach out to the Niagara Region Alzheimer Society, where she is right now. So thank you so much for sharing your story and for giving us a better understanding of the experiences of care partners. And thank you to everyone else who has given presentations today. Thank you to our partners with BrainsCAN, the Alzheimer Society of Ontario and the Alzheimer Society Southwest Partners, and to all of you who have joined us here today during Alzheimer's Awareness Month. If you'd like to learn more about the Alzheimer Society Impact Survey, the link is on the screen now. So please visit brainscan.ca/Alzheimer's report. You can also connect with us on social media. We're going to conclude the formal portion of our event right now. I see that there are a couple of questions in the Q&A already. If anybody else has questions, please add them to the Q&A box at the bottom of your screen. We've got about 15 minutes or so to answer some of your questions. So I'm going to start with the first one here, which starts with amazing work, which is thank you. Well, on behalf of the entire team who has done all of this work. The question is, I need to put my glasses on to actually see this. I'm wondering if you were able to compare Alzheimer Society of Ontario client data to the data of non-clients for actual health service use. For example, you presented that Alzheimer Society of Ontario clients self-reported that they delayed their entry to long-term care by an estimate of 1.4 years on average. Were you able to verify this by looking at the timing of actual admission of Alzheimer Society of Ontario clients to long-term care compared to non-clients? Brian.
Yeah. Oh, no.
Thank you.
Firstly, that is a fantastic question. It's really the next kind of logical step when you look at this from kind of a research lens. And really that kind of comparison is a bit out of the scope of what we were doing here. We were more looking at what the Alzheimer Society does from a self-reporting kind of perceived benefit. But the next logical step might be for this to then start going into some of that healthcare data to see if we can verify it. Maybe there's a discrepancy there where the benefit could be larger than what they perceive, or it might be smaller. So this really is just a starting off point based on that. And one of the things that we hope by making this a publicly available thing with all of the data freely available is we want researchers to then run with this, maybe take some evidence from here and then do that more rigorous study that would have kind of the proper control groups and things like that. That's a very kind of because of the kind of heterogeneous population of what dementia looks like. It would be a very kind of complex, but definitely worthwhile avenue of study.
Thank you, Ryan. Is there anyone else that would like to comment on that question? I think Ryan answered it pretty comprehensively.
Maybe just add a little to it. So the Alzheimer Society of Ontario actually has a partnership looking with the provincial government, looking at health card data to specifically related to our clients, of course, anonymized, but to be able to look at their health system utilization directly related to their health card. And then, of course, that information can be compared to the general population as well. So this particular study is a great foundation. And I think when we look at the actual health card data, it will confirm what we have learned through this impact study.
Fantastic. Thank you, Cathy. Okay, I'm going to move on to the next question. Glasses again. Okay, so today's this is a question from Matt. Today's presentation mentioned the volunteer companion program used by Deb to help her delay the need for long-term care. What other programs and services offered by the Alzheimer Societies can assist care partners to care for those living with dementia at home? Carol.
Hi, I'll take this one, Lisa. Yes, there's a number of different approaches we use to support care partners, from one-on-one counseling to education. We know knowledge is power. So the more people understand the aspects of Alzheimer's disease and other dementias and what to expect can certainly help them prepare. And that's what our clinical team staff do. We also set up a number of support groups. So we know how important it is for our care partners and people living with dementia to make connections with others that are in similar situations. So through making these connections at support groups, I think it's a really important creating or establishing a new network of friends that are going through similar situations. Deb mentioned the volunteer companion program. We've now moved that program to something called in-home therapeutic recreation or in-home recreation. This and the reason we did that is really evolving the concept of the volunteer companion program, which Deb spoke to beautifully, and how meaningful it is to ensuring we're supporting our volunteers in being able to best engage the person that they are supporting through a therapeutic assessment and lens and understanding what aspects of the relationship that can be built between the volunteer and the person with dementia will be most meaningful for that long-term relationship. And finally, we launched a program this year called The Social, where we're bringing 12 clients a day, so 6 in the morning and 6 in the afternoon for 3 hours of group social time. And we do this 5 days a week. So we're seeing 60 clients a week. During this time, it provides care partners with respite. And we know how important it is for care partners. We've had some care partners describe this time as a reset for themselves, so they can better work and support the person that they love, that they're living with at home. So we kind of tackle it from a number of different avenues to ensure that we're addressing all aspects of care partner need.
Thank you, Carol. And that is just an incredible array of services for people. I think we're very fortunate to have such an organization embedded in our local community that we can turn to when we need to. Okay, we've got more questions here. We've got a question from Inbal. Thank you for all the presentations and your incredible work. Can you share more about how this collaboration between researchers and a community organization was formed? Are there lessons that you learned in the process that can inform future collaborations like this? I'm just going to say one word, and then I'm going to turn it over to the people who actually drove this collaboration. But I want to say part of it was this, this very unique federal funding mechanism that has given us at Western a few extras, actually, so most research funding goes toward very specific projects. And in this case, our research funding has actually allowed us to assemble a team beyond just the researchers, but also a team including communications experts and data analytics experts that's allowing us to take what we do in the lab and actually take it out into the real world, both in terms of these community partnerships, but also partnerships with industry and partnerships with the hospital as well. So that kind of extra little bit of funding has been incredibly valuable for us in really making our research move more toward reality. So that's part of it, but part of it is all of the work that was done on the ground. And I'm wondering, Ryan and Carol, if this is something that maybe you could speak to?
Yeah, sure. So it really happened kind of in the most organic way that you could imagine. I actually forget the reason why we had that first meeting. We were discussing a different topic. We were over in the boardroom that's actually just right there. And we got onto this, just chatting about this work. And there was so much kind of passion that it really came out. And then you were mentioning that, it would be really great if we had more numbers when we're going to funding agencies or doing this. And then it was a kind of a bit of a match made there where it's like, well, that's what I do here. I take things within research and I try to quantify them in a way where we can show impact kind of on the large scale. So then we started from that earlier one and it went from there. And what I kind of don't like sometimes is when these things are so kind of like happenstance, because we want to make sure that you don't have to just be in a meeting with someone accidentally stumbling on this. We want to be a little more active moving forward. So I know from my side here is we're developing a bit of a toolbox now that we can kind of use to then help, whether it's different societies and things like that. So yeah, it was one of these things that just started snowballing in the most kind of positive way. But we want to make sure that this type of interaction is a little easier to happen and you don't have to rely on just happening to put two people in a meeting that had kind of complementary skills.
Yeah, and I have to agree with you, Ryan, that the project we moved forward with was quite organic in how we pulled it together. I have to say, who made the connection was Maggie McCullen, who was mentioned earlier. She's behind the scenes today, but was so critical in making this connection. Maggie was a care partner for a parent with dementia, and she was connected to our society, meeting with us one day about supporting a young care partners support group that we were going to start up. And I asked Maggie about her job, where she worked, and we started talking about this wonderful research center up at Western called BrainsCAN. And you know, I mentioned I'd be interested in meeting with someone there just to explore some opportunities on how we could potentially collaborate. So I'm really grateful for Maggie and the connection that she made. The Alzheimer Society Southwest Partners, we do have a pretty tight connection with Western University. We're just down the road. So a number of our volunteers are Western students. So we have a pretty excellent relationship, and we've got board members that represent the research arm of Western. So also through our board members making connections for us and helping us sort of define what is our research question, what is it that we need to analyze and understand a little bit better. It's really kind of helped that organic conversation we had and helped us land where we are today. So yeah, it was a great partnership, and I'm so grateful for Ryan and Maggie, who have been so critical through this whole process.
Thank you both of you for addressing that question. It really highlights to me, you know, in the research world, we're often talking about global impact and, you know, national impact, and that's hugely important. But I think what we have to remember is that often those relationships that are built within the community and that local impact is the sort of, you know, the crucible of some of this work. And that's where, and that's where we can really develop partnerships and relationships that can expand out to national and global impact in the future. So it's really important to consider our local roots in all of this. Okay, so we've got more questions. Actually, I think we've got one question that was answered online about, was that answered online? Sorry. Yes. Okay. So I'm gonna move to the last question now. I think we have time for just one more, and then if we have a couple of minutes at the end, maybe open up the floor to the panel in case they have any last comments they would like to make before we finish. So the last question is from Laura, and it's the question is: Dr. Salewski's presentation focused on three main areas where Alzheimer Society support saved money for the Ontario healthcare system. So fewer hospital visits, delayed access to long-term care, and continued care provided at home. I imagine Alzheimer Society support can be extended to other cost savings. Why was the focus on these three areas? And did you find other areas where Alzheimer Society supports Ontario's healthcare system?
Yeah, I would be more than happy to provide a little bit of a context here. So those three areas were by no means kind of meant to be the entire picture, but rather just the kind of access points that really lent themselves to that type of return on investment type evaluation. So there were a few other areas where there was definitely a benefit seen, but we just had trouble kind of like putting an actual dollar value on it. The one that really jumps out to me was we saw that about 35% of care partners that had the person that they support had been hospitalized. They said that they had increased confidence when they returned to providing care following that because of the support they received from the Alzheimer's Society. So the logical extension there might be that was a shorter hospital visit because they had more confidence when they were bringing them home, or maybe it might reduce the readmittance kind of following because they were properly set up for the additional challenges that might be. So those are ways that would have a direct impact. It's just harder to kind of put that dollar value on. So yeah, we just wanted to kind of take a bit of a snapshot on kind of one area that shows kind of what this return on investment is, but there are countless ways actually where you can see these benefits and you can envision a way where it would trickle down to the healthcare system and then provide this benefit for everybody.
Brilliant. Thank you, Ryan. And thank you to the rest of the panel for your comments and for your answers to the questions. I would just like to, we have like 2 minutes left. Does anybody on the panel, Peter or anyone else like to just make a couple of comments, any additional ones to wrap up?
All I would say, Lisa, is just to reiterate the importance of the partnership, which I think can serve as a model for the country. In fact, I was going to say the province, but certainly for the country. This is unique. I think that we have a local organization here with the Alzheimer Society Southwest Partners that where the linkage was first made, but then it just extended beyond, and there's people that will benefit here. And it's data driven, which for someone in my position, looking at it from a policy perspective, the savings, and yes, healthcare is an area of provincial responsibility, obviously, and I'm a federal MP, but even still, there's other elected leaders on this call. We all care. It extends beyond party. We all care about health. We all care about issues in our community and challenges that people are facing from a health perspective. So just a huge message of appreciation for the support, and hopefully we can see this replicated in different parts of Canada.
Thank you, Peter. And thank you to everyone else for participating on the panel, and thank you to all of the attendees. I'll just redirect you to our website if you want any further information, and please feel free also to connect with us on social media. I think we'll finish up now, and thanks everybody for joining.